What is it that examiners are actually trying to assess in the exam beyond just a candidate's medical knowledge? What is it that the examiners are looking for in that setting?
So you take the in-training exam, you take part one, that's all about knowledge. So we kind of take that almost as for granted that you have good knowledge by the time you're sitting for part two, although we'll talk a little more about how that envelope might get pushed. But it's a lot less about facts and it's much more about your capacity for problem solving. For example, are you listening to your patients and really doing a targeted exam? Obviously, you have to document that. Do you understand what the differential diagnosis is for that knee pain? And are you taking the next step to get the appropriate diagnostic studies if necessary? And then once you have gone down that path, was your choice of surgery appropriate? Certainly, was it well executed is a big part of it, but there's a lot that leads up to the OR. I think everybody tends to really focus on, oh, my x-rays, oh, my heavens, that screw could have been a little shorter. Was my version exactly the way it should have been? But there's a lot that leads up. Remember, orthopedic surgery, like all of medicine, is a practice. We know where we really hope that by the time you're a few years out of fellowship, you haven't reached the apex of your clinical and surgical skills. But we hope that you are doing all the steps that it takes, because if you're not taking good history and you're not doing a good physical exam, you will never be a good surgeon, regardless of how your clinical skills or your operative skills may improve.